The leader of Ghana's coronavirus test team, Dr.Samuel Kaba Akoriyea, says Ghana's COVID-19 case count will not hit the thousands as seen in the US and the rest of the world. Now, in an exclusive interaction with JoyNews, he said the 2-week lockdown ordered by the president, Nana Addo Dankwa Akufo-Addo, has proved timely and produced significant results, which so far have also helped stem the tide in the spread of the virus in Ghana. He has been speaking with Latif Idris, who was given rare access to the Ghana East District Hospital, the main center for holding and treating coronavirus patients in the country.
Talk of frontline health workers delivering healthcare to Ghana's COVID-19 patients, and you find them right here at the Ghana East District Hospital. Here is the center. This is where most of Ghana's COVID-19 patients are being held. The tape you find behind me separates proper frontline health workers and their clients from auxiliary or secondary frontline workers like myself. In here, the nurses and doctors are racing against time to save the many lives that are in the building behind me, currently battling with the deadly COVID-19. On the corridors of the health facility, JoyNews camera captured some of the patients receiving treatment, pacing up and down. Leader of Ghana's coronavirus test team, Dr. Kaba says most of the patients are responding positively to treatment and expresses confidence the country will not get to the levels of the US and Europe.
With these appropriate actions taken is to contain this. So if you even see of late, our numbers have not been increasing. We're in 204, we moved to 214, and we are still 214. It will go a little high, but we don't expect it to go much than the system can contain.
Is that a hope you are expressing, or that is what is going to happen?
You see, this is what will happen, right? When you lock down and you start testing, the more people you test, you might get more positives, right? So I will not be surprised to have more cases positive, because that is the purpose of locking down, to identify them early. And then you prepare yourself for that. But it also gives us that window of breath that the next 2 weeks we should be having less, because we had locked those at home. Yeah. So it's not only a hope, and of course hope is the last thing you lose. I do have that hope, but it's also reality that measures of containment has been taken at the appropriate time for us not to go to the thousands.
So Dr. Kaba is confident Ghana will not hit the thousands when it comes to patients. When do if we continue the way we go and the way we are doing things. When should we expect the curve to flatten? Okay. How soon should or would Ghana's curve flatten?
Okay, I'll help you with that in a way so that you understand. In every country, whatever it is, you always get a peak and then it starts to drop.
Health workers undergoing training here to be put on the front line of the COVID-19 fight say they are unfazed with the dangers associated with the deadly virus.
While others will call it a risk, I would want to call it a privilege. All over the world, other staffs, I've seen other nurses who are also sacrificing to help our colleagues who are having this ailment or this suffering from this pandemic.
Because it's something like a worldwide something spread, definitely there will be a little fear inside. Definitely, no matter who you are, there's a fear that you can encounter. There's some little fear that will come your way. But as a health worker, you should rather take away the fear and know that you are in for this, and it's a passion.
But as he said, the battle is a lot, and then as a health worker, you should be ready for anything, because it could be your family, it could be your partner. Anybody can be there. So supposing I was the one there, I would need somebody to care for me. So I think that we are just doing it with a free will, not thinking about anything.